Okay, so getting lines and wrinkles is just part of the aging process, but there are things that you can do to minimize or maybe even diminish the effects through the process called facial rejuvenation.
Yeah, Delmarva Life's Brian Spires joins us now from the Salisbury office of Dr. Robert J. Davis, a board-certified plastic surgeon. And Brian, it looks like you're going to get a little bit of work done.
Well, Jimmy and Lisa, I actually have been getting some work done. I got a chemical peel. Don't laugh at the headband. And I'm doing all of this just to give the viewers the full, tutorial of it all, unless you're suggesting I need some work. But anyway, we'll talk about that later. I want to introduce you first to Rebecca Ospital, who is a physician assistant here at the office. First thing, explain what exactly facial rejuvenation is.
Facial rejuvenation is just about improving what you have. We like to correct any sun damage from the past, fine lines we might have, plumping up the skin and improving tone and texture.
All right, and now there's a lot of different ways in which you guys can do that, and we have some of them behind us. Explain what they are.
We do. First and foremost, we have our sunscreen. That's #1 step to make sure we protect our skin now and then protect if we were to do any procedures. #2, we have topicals, anything from vitamin C antioxidant to a retinol gel to help plump the skin with your collagen. Next, we have an injectable Botox. It's a neurotoxin to help with fine lines and wrinkles. Fourth, we have these fillers to help volumize some lines around our face to restore a youthfulness to our faces. And lastly, we talked about some chemical peels to kind of peel off the old damaged skin, bring forth the new, fresh, plump skin for all of our patients.
And you did the chemical peel on me. Explain exactly, briefly, what you did and what the chemical peels actually do for the skin.
For you, Brian, I did the aluminized peel, just a nice fruit acid to kind of plump and give your face just a glow. Usually our chemical peels, there's some peeling involved. You have some downtime about 48 hours later, but we're resurfacing, getting off the dead, taking off the spots, and really improving the softness and the tightness of the skin.
So let's talk real quick too about the neck. People get stuff done on their face, but then you could tell because the neck has been left untouched. What advice would you have when it comes to that area?
We need to include the neck when we do our facial treatments. For anything that we do, the sunscreen, the topicals, even the chemical peels, let's treat the neck at the same time. Let's be more gentle. It's a sensitive area of skin, but let's include it.
The other thing too, which we were talking about earlier, is that people think if you get Botox or these chemical peels that you're vain and all about beauty, but it's really about a person feeling good.
That's right. We just like to help with self-worth, self-esteem, because looking good makes you feel better, and this is not about vanity. This is just improving what you have and feeling on the outside how you feel, looking on the outside, actually how you feel on the inside.
On the inside. The other thing too is you have people watching this right now and may say they want to get something done, they're afraid. You guys actually sit down and have consults with people. Tell me a little bit about that.
We do. We offer complimentary consults where they can ask as many questions as they like. I tell them everything we have. It's a full informative, as long as they need, time with me, and then they're allowed to make a decision. We'll formulate a plan together.
And the other thing too that's pretty interesting is you get not only women, but there's also quite a few men that come in for work.
I do. I take care of a lot of female patients, but we do have male patients. Sometimes their reasons are different for coming to see me, work-related versus I have a wedding that I need to go to.
Right.
Either way, it's just about improving what you already have.
All right, Rebecca, a lot of good information. Thanks so much. And for more information on the office of Dr. Robert J. Davis, you can go to our website, delmarvalife.com, and click on the show tab. Jimmy and Lisa, I'm going to be a new man when I come back to the office with my face. So we'll send it back to you guys in the studio.
Are we going to recognize him when he comes back?
I don't think so, yeah.
Wear a name tag or something, Brian, just so we can be sure.
He'll look like a 16-year-old.
That's what it's going to be. Up next on Delmarva Life, the Furniture Fix promises to lift and fix your sagging upholstery. Guess what? We're going to put it to the test.
But right now, here's a look at what's coming up in the news on First at 5 on Fox 21 and later on WBOC News at 6 and 7.